Okay, we've got a couple of viruses that are very contagious that are infecting more people in Minnesota than they have in years.
Whooping cough and measles are spreading, and hospitals are on alert. Fox 9's Corin Hoggard is live at Children's Hospital, and Corin, doctors say these illnesses can be prevented.
Yeah, that's right, Karen and Tim. Hundreds of cases of whooping cough and dozens of cases of measles are spreading all over Minnesota right now after basically going dormant for at least the last 7 years.
That type of thing.
The signature whooping cough of a pertussis infection can last for months. And in Minnesota, 826 people have had it in 2024, more than in any full year since 2016. Patients include students at the University of Minnesota and at schools in Minnetonka and Rochester. And doctors are especially concerned when younger patients show symptoms because it can be deadly.
Pediatricians know that this is circulating, and so we are extra cautious, really looking at our patients very closely to see could you have these and testing for it when it's appropriate.
The same is true of measles. Although the number of confirmed infections is much smaller at 52, it is a big concern. The measles virus is highly contagious, and it can cause complications severe enough that about 1 in 4 measles patients will end up in the hospital.
Vaccines are highly effective against preventing this disease and those complications.
Minnesota vaccination rates have dipped since the COVID pandemic. The Department of Health says 77% of kids born in 2021 are up to date on whooping cough vaccination and 82% on measles, both falling significantly over the last decade. Alina's Dr. Eric Barth says he's noticing some vaccine hesitancy.
We're a victim of our own success, meaning that we've been so successful in using immunizations to protect children that parents aren't aware that these illnesses are still out there.
And no more than one of those measles cases involved a vaccinated person. That vaccine actually lasts a lifetime. The whooping cough vaccine, on the other hand, requires a booster shot about every 10 years. So there are some people getting sick with whooping cough, even though they've been vaccinated, but usually more than 10 years ago. Live in Minneapolis, Corin Hoggard, Fox 9.
All right, Corin.